There is a bacteria that can be found in tap water, shower heads, a stream from hot tubs, and soil from parks and gardens. Now, this bacteria doesn't have an effect on some people, but for others, especially with COPD, this can be serious. Dr. Shannon Kasperbauer is here to tell us more about the risk and about a lung disease that we should all be knowledgeable about. Doctor, thank you so much for being with us.
Thanks for having me.
Let's talk about this lung disease that I'm kind of alluding to and how it relates with COPD.
So NTM, as you said, stands for Nontuberculous Mycobacteria, and these are organisms that are readily found in the environment, and we all probably inhale them every day. But certain people are at greater risk of developing NTM lung disease, which becomes a progressive chronic lung infection. And in fact, in 2010, there was a study that reported there's at least 86,000 cases, but we're seeing a rate of 8% increase per year. And those risk factors include people with COPD and any person with an underlying lung condition that causes damage to their airways, such as asthma or bronchiectasis. And they have a harder time clearing the bacteria from their lungs, and so we see rates in COPD that are 15 times higher than patients that don't have COPD.
And what are some of those signs or symptoms that we should be looking out for?
Yeah, so the important symptoms include a chronic cough, and that can be a productive cough of sputum or a dry cough. Some patients have shortness of breath. Others have significant fatigue with their infection. Patients can lose weight or just have a poor appetite. And fevers, chills, and night sweats are important symptoms to look out for. We also recognize there's a group of patients that just have recurrent episodes of bronchitis or pneumonia that's poorly responsive to routine antibiotics. And I'll just comment that all those symptoms I just described can mimic other lung conditions. They're non-specific. So unfortunately, delays in diagnosis are common, and some of our patients have been having symptoms for months or years before they're ultimately diagnosed.
Well, and that's why it's very important to get tested because, like you said, those signs and symptoms can seem like something else.
Correct. And the longer that those symptoms progress, the more likely they are to develop irreversible changes to their lungs. And we want to try and prevent that. And the ways to get tested are simply to get sputum cultures for mycobacteria and a CAT scan of the chest. And that's actually more important than just getting a chest x-ray. We really need the definition of a CAT scan to diagnose this lung disease.
Well, and there's so much to know about this, and we were seeing how readily available that bacteria is just in a lot of everyday things. Is there somewhere we can go online to kind of get some more information and, of course, learn if we're at risk?
Absolutely. So there's two important websites I'd like to tell your viewers about. The first one is aboutntm.com. And in this website, they'll find more information about NTM lung disease and also help formulate a discussion or a conversation they can have with their providers. The second website is ntminfo.org. And this is a really nice resource to be able to connect with other patients who are struggling with chronic NTM lung infection.
Well, Doctor, this has been very helpful, very educational, and we definitely will check out those websites. Thank you once again.
Thanks so much for having me.
Don't go anywhere. The Morning Blend will be right back.